neighborhood is the world. My neighborhood is where you live and where I live. We are all connected, and for all of us to be the best that we can be is important. I thank so much Bridgehaven Mental Health Services for accepting this time to come in and talk to us. The CEO and president is here today, Stewart Bridgman. Thank you.
Great to be here. Thank you.
And I sat down. I said, Stewart, you know that we have confined time, and we're going to do the best that we can, and we're going to definitely have you come back. What is going on? You know, I sit and I look at the news we give, and people are socking each other on airplanes, and people are mad. And what is going on? This is not what we call normal.
Right. I was trying to think. I always like to use analogies.
Okay.
So if there's a family that's living in Afghanistan, and then the next, after a couple jumps, they're living in Indiana, everything is new to them. The whole world, everything in Indiana is different than in Afghanistan. So some people are going to thrive in that environment. They're going to adjust real quickly. Other people, it's an adjustment issue. They're struggling with everything is new. The language, the grocery stores, technology, everything, our culture here is completely different. So they're struggling, and everything looks the same, but because COVID, everything's different. And
so it's almost like we have been plopped with, not like we wanted to, we have been plopped in the middle of all new that we've never known before, and there's really no way to get all the answers.
We can't go back 100 years ago and ask our elders what
how did you all survive the flu when it hit, right?
Right. So it's all being reinvented. We have to adjust, and some people are thriving, and some people, an adjustment is just really hard, and it's just that's what it is.
And so many of us disagree about everything, and nobody get mad, but I'm trying to use the words that I know. Even so-called, I know this is the wrong terminology, but even so-called normal people who just have never had a problem, some of us have gone off the edge.
So yeah, I think that everything's in a continuum. The rules are constantly changing. Is this a rule? Is it not a rule? So, there's four major emotions: mad, sad, scared, and glad. Sad is a great emotion because it helps us deal with the past and letting go. What was the world like before COVID? Why can't we go back to that? If you're really struggling with that, that's when you need to talk to a therapist. You can't,
Okay, I'm going to stop you there, and I want you to go through the other three. But what should be the click to let me know, okay, girlfriend, look, you are not handling this. You need to talk to someone.
Just someone that is constantly just referring to the past, sad, just having a hard time looking to the future.
Okay.
So anxiety is a great emotion because it helps us prepare. On the way here, I crossed the street, I stopped, I looked to make sure I was going to be safe. So it's a good emotion, but if I don't know what to expect, it can be overwhelming. So when I'm overwhelmed by the anxiety of what's going to happen in the future, and that's where my issue is, again, that's where I need to
talk to someone.
Talk to a therapist.
Okay.
Anger is about what's happening right now. And typically, if you think about anger, you can say, what do I want to change? What is it? It's not what's making me mad, but what is it that I need to change? And typically, I want to change this person here who's not doing what I want them to do, or it's making me do something I don't want to do. But the only thing we can really change is ourselves. And if you're having a hard time thinking about how to change yourself, that's when you need to go to a therapist.
All right. And we don't need to talk about glad, I guess.
Glad.
We all love glad.
Glad is what we all want to feel like.
We love glad.
What does it do? It allows us to deal with the other three emotions, right? Because if we only felt sad, mad, and scared all the time, we would be pretty miserable.
So how do you deal with things that are overwhelming if you feel like you haven't gotten to the point of calling someone?
So, yeah, if you have someone that you're worried about, you say, hey, they're feeling one of these three ways, then, take them out for an ice cream, take them out for a coffee, go talk to them and ask open-ended questions. Don't, like, how are you dealing with COVID?
Don't ask yes and no, because you can ask a question, they go, no,
right,
yes, and the conversation is over.
Right, and the other thing is you yourself are probably worried about them and anxious, and so you need to give them pauses so that they can say what they need to say.
Okay, so you just made a point. If you have someone you love, friend, family, whatever, and now you're bringing them in, you're asking open questions so they have a chance to talk to you. What happens if you look and the family says, we have a problem? He's either dangerous to himself or herself, or he's dangerous to someone else, or he's truly not even thinking clearly at all. What am I as a friend or a mother or a neighbor supposed to do about that? What's the legalities, and then what's just what you should do?
So, I mean, if you're concerned, you yourself can call a suicide hotline and you can ask questions. You say, hey, I got this person here. I have some situations. Help me manage that. If it's a family member, I would suggest going yourself to talk to a therapist yourself about that situation and how to handle that situation. It's okay to, say, hey, this is an issue, and we're not expecting everybody to be therapists, but it's okay to go talk to a therapist, get advice on how to handle that situation, what's going on in your own family.
So I had a woman who called me. She emailed me first, put her information. I read it. Basically, her daughter, she thought was dangerous to herself and others. And she said, her doctors have not helped. She said, I need to do something now. I didn't know what to do. I just called the judge friend because, I'm like, okay, I got networks. And I said, what do I do? They ended, thank you, I won't say the judge's name, thank you to that person. But they ended up doing some kind of, I want to say, inquest it was a legal thing. The mother had to go through legal steps.
You can go down to the courthouse and have a mental inquest warrant on someone that you care about if you're worried about them. And in that process, a judge has to approve that. Not anybody can just go get it. And then if they approve that situation, then they will send out a CIT team to that person's house to assess the situation.
How much trouble, because as a mom, if I did that to one of my kids, my first thoughts would be how much, and I know we should just be thinking that person's dangerous, but I would be thinking, how much trouble is that going to cost to my child's life?
So,
as in just ruining it or whatever?
Does going to the hospital or getting help ruin your life? Absolutely not. Absolutely not. It's you're there to help that person. And first of all, I want to say 99.99. I mean, mental health is just one branch of a tree.
Right.
People who commit murders are a separate branch of a problem. There's no necessary correlation with one to the other. But if you're worried about your loved one that they might hurt themselves or they're feeling so scared, then yes, you can go and get help and ask for that help and talk to, you can always do a mental inquest warrant, and they will tell you, they'll walk you through this. It's the same place where you go to pay your parking tickets.
Hallelujah, I haven't paid a parking ticket in quite some time because I haven't gotten one. But that's right downtown. It's not it's a difficult thing. So for those who are at home, and they know, it doesn't have to be something huge and big for you to go talk to a therapist. Right. It doesn't have to be big.
Well, an adjustment disorder is not a mental illness, but if you are unable to adjust for several years, then it could be classified as a mental illness. But everyone has adjustments: the loss of a spouse, a change in jobs, transition. Any major transition in life, you're adjusting to a new reality. We just all happen to be adjusting right now to a new world where there are new rules because of COVID and and it seems like it just keeps going on forever.
I mean, I have a friend, she owns her own business. It's stressful, and sometimes she's like, I just need to talk to somebody. And she always looks at it, I mean, she goes, I keep my therapist on speed dial. Right. So when I want to talk, it's an easy thing, and 2 seconds later, I'm like, why was I worried about that? But some of us, like, don't even know the step to, like, find a therapist because we don't want to talk about it, right? You don't want to ask somebody because, oh my Lord, that's taboo. Number one, why is it taboo? And if I need a therapist, why wouldn't I do exactly what I do when I need new tires and say, hey, anybody know a good therapist? We won't do that.
Right. There's many times when you call on a specialist, someone that's good at that field to help you with whatever issue it is. So at work, call your HR department, ask, most of them have an employment.
And you know, even at work, I had somebody, and I won't say the name, maybe I shouldn't even say here. I had somebody here who said, what happens if I call HR and I say, I'm just feeling a little blue? Like, are they going to write that on my employee record?
An employment assistance program doesn't report that to your employer.
They're not supposed to at all.
No, but it's a benefit your employer wants you because they want you to be healthy.
You just said a word. A benefit.
Right. So if you're in a situation you don't have that, you probably have a mentor, a spiritual advisor, director, someone that you can go talk to about issues and helps. If that person says something bonehead and doesn't help you, get a second opinion.
Okay, wait a minute. So you just said something else. There's so much. We're going to have you come back. Therapists are people too.
Correct.
And so sometimes you can have these are my words, you clarify them. Sometimes you can have a therapist that is a bonehead. It's a possibility.
Right.
Okay.
Yeah.
All right. So don't like that person says something to that you're like, what the heck?
I'm never going to go back to another therapist.
Don't say that.
No. Keep going. Keep working at it.
Okay. When in this time that we have,
right.
What do you want to share that you say, I wish I could tell the public this, or I wish people would realize this? What is it?
I think the entry to mental health is so complicated, so convoluted.
Why?
Because there's so many different layers, and we normally let things get to stage 4 cancer level and it's emergency, and insurance sometimes doesn't even want to pay for this. I need basic support early on. Insurance is like, they want to wait till it's a crisis, and sometimes if you deal with it, I'm adjusting to a new thing, I need to talk about this, I can take care of it and move on with my life. I don't need to let this problem fester. So talk early, talk soon.
Okay, so then there's another problem. Don't get me started on insurance because I'll be talking until next week. If insurance won't pay for it, and you need help, and you don't have $15,000, like my friend's therapist, her insurance won't cover it, but she's got $400 a session to pay that, then where do you go? And that's an issue. If you know you need help and you try to get help, but you can't pay for it, what are you supposed to do?
It's a change, and you need to go call places, call Bridgehaven, ask us what the situation is. I think our website is there. Call us and ask questions.
Yes, there's the phone number, and there is the web page. And again, you can at least call Bridgehaven and get help, because there are services in this city that are free.
Yeah, everything's person-centered, and so it's impossible to talk about every scenario. So
it's impossible. Yeah.
If you call in and you say, hey, these are the issues that I'm having right now, then we can say, if we're not able to help you, here's where I would go, here's what I would do. Because there are services out there that are available to people.
And I think, Stewart, for me, this is the important thing. Sometimes it just feels like there's no answer. But there's just not an answer right now. There is an answer.
Right. And it takes a while to find what's really going on, and you have to want to change yourself, and you have to want to understand the situation. Am I afraid to move forward? Am I spending too much time? Am I looking back and I can't let go? Or is it something that's bothering me right now and I just need to change? and it's a process. It's nothing is it's complicated. Things were
are
complicated.
complicated.
People were complicated.
I have learned when I get overwhelmed, and I've been more overwhelmed in the last 2 years than I have ever been in my life. And I was in an abusive marriage where my husband thought the normal thing, if I asked the question, was to punch me in the face. I've been it was, but I got through it. But what I'm saying that for is I've been more overwhelmed now than I was then. So you have to take care of yourself. That is the National Suicide Prevention Lifeline. If someone is feeling as if you can't, there are people who love you and you will unbelievably turn their world into something that they can't fix if you do something to yourself. Don't do that. 1-800-273-TALK, suicidepreventionlifeline.org. And just one more real quick question, because we've run out of time. People always feel like if I ask my son or if I ask my daughter, are you thinking about suicide? That will push them to suicide.
It will
that
not.
will not.
The more you talk about it, the less the possibility. It's okay to talk about it.
Okay.
Absolutely.
You know we're going to have you come back.
I'll be happy to come back.
I thank you. We didn't get to all of it. I know that, but I'm just trying to get to you as much as I can. Again, bridgehaven.org, 502-585-9444, and then you saw the suicide prevention line. Okay, hang on. We have got more coming up. American Heart Association, the Heart Walk coming up. So